This is chapter 16, part 2. I said at the end of the last video clip that we would cover two terms that can be a little confusing, the sensitivity of a test and the specificity of a test. Sound similar, um, and conceptually they are somewhat similar. So let's see if we can sort these two out. So what do we mean by sensitivity of a test? This is determined by the likelihood that a specimen containing drugs will test positive. This outcome is referred to as a true positive. So let's say that the person has this illegal substance in their body. Um, the sensitivity of the drug is the ability of the drug to pick that up, to detect that it's there, that drug is there. And that's a true positive if you indeed have that drug in your system and the test detects that accurately. That's a true positive, and to the degree that it can detect that drug, even if there's not much in there, even if there's not too much too much of the drug in your system, that's a highly sensitive test if it can still pick it up, still detect it, even if there's not much drug there. So sensitivity, the ability to pick up the presence of the drug, and that's called when the test results come back and it says, yeah, there's drugs there. That's a test positive. It's only a true positive though if indeed that drug is in your system. If a drug test has a high degree of sensitivity, then there will be very few false negatives. Okay, meaning that if test comes back and it says, hey, you don't have the drug in you, but indeed you do. It just failed to pick it up. That's what we mean by false negative. It failed to pick up to detect the drug. If a drug's really sensitive, that doesn't happen too much because it can pick up that the drug's there and pick it up even if the drug is in small amounts. If a test is sensitive, the subject will seldom test negative when drug taking behavior has actually occurred. So you get it? So if you got the drug in your system, you did take the drug. If the test is highly sensitive, it's very likely it's going to pick it up. It's going to detect that you have that drug. You're going to be unlikely to get away with it. It will detect the drug. So that's high sensitivity. In other words, there will be very few misses. So if the drug's in there, you're probably not going to get away with it if the test is very sensitive. Now, but specificity is a different issue of the test. It's determined by the likelihood that a drug-free specimen will test negative. So this is kind of the flip side. I don't have any drugs in my system. Uh, a, a test that's is high in specificity, um, it's very unlikely that it'll come back and say that I've got the drug when I don't, right? So the true negative, what they mean by true negative, is that the test comes back negative, indicating that there's no drugs in the system. And indeed, that's the case. That's the truth. That's the condition of the person. They didn't take the drug. They didn't have the drug in the system. And the test comes back and indicate that. That's a true negative. If a test has a high degree of specificity, then there will be very few false positives. In other words, there will be very few false alarms. So if a test is really high in specificity, you're not going to get too many times when the test comes back and says, yeah, the drug is there. And it's not, right? That's false alarms, and it's not. So it's two different aspects of the test, the specificity of it, and then the sensitivity of it. So again, a little tricky. Hopefully, you folks get that. Um, go over it a couple of times if you need to get that clear in your mind. So here, let's talk a little more about it. Sensitivity is an index, or index means like a measurement, indicator. Sensitivity is an index of the ability of the test to correctly report the presence of a drug. Correctly report the presence of the drug. High sensitivity, high chance that it's going to correctly find that there is indeed drugs in your system. Specificity is an index or measure of the ability of a test to correctly report the absence of the drugs. So, in other words, another way of putting that is that high specificity means that it does a really good job of ruling out the drug when you don't have it in your system. Okay, so it's just they're basically kind of opposites in a way of each other. One really good on the positive, and one really good on the negative. Ideally, a test for screening the presence of a drug or a drug metabolite should have a high level of sensitivity and a high level of specificity. That's a fancy way for saying a good test is one that gets it right. That gets it right and doesn't make many mistakes one way or the other. Right? Doesn't have too many false positives and doesn't have too many false negatives. It nails it, it gets it right every time. That would be the perfect test. The GCMS test is more sensitive, okay, and specific. So both of those things, it's a better test than the EIA test for a variety of drugs. Just remember that between the two, that GCMS with all the involvement of gas in the process, right? That that's a fancier, more effective method and more expensive. As mentioned earlier, a GCMS analysis is typically performed as a confirmation of a positive EIA test result. So you do the cheaper, faster, easier EIA test, and if it says positive, this person's got drugs in their system. Well, you want to make sure. You don't want to, falsely accuse somebody of having drugs in the system. You don't want to make that mistake. So how do you make sure that we're right, that drug really indeed is there? Well, you do the more sophisticated GCMS test as a confirmation because it's more sensitive, more specific, meaning it gets it right more often than the EIA test. No drug test can guarantee perfect sensitivity or perfect specificity, much less both in combination. So tests, that's one thing to keep in mind. Tests are not a absolute 100% guarantee of being accurate. There is a certain amount of error even in the best tests. So that's just the flaw of so many things in life is that certainty is elusive in so many things. We just don't have certainty. False positives can occur even with the GCMS analyses. For example, eating a poppy seed roll prior to drug testing or taking quinolone antibiotic medications has resulted in false positive indications of opioid use. So the chemical structure is sort of similar enough. These tests can test positive falsely, incorrectly, if you have consumed certain things like poppy seeds would be an example of that when it comes to testing for opioid use. Also, a couple other examples. Therapeutic levels of ibuprofen, pain reliever, have resulted in false positive indications of marijuana smoking. See, so again, there's got to be some sort of chemical similarity between the ibuprofen and THC in marijuana that it has created false positives. See, so those are a couple of examples of where these tests are not perfect. The passive inhalation, we've talked about this before. Remember with passive inhalation, we're talking about you're hanging out in a room where there's a lot of, marijuana smoke. Not and you haven't been smoking yourself, but you're just sitting in a room with a cloud of smoke and you're breathing it in passively. You're breathing it in. You're not smoking it, you're just breathing it in. That's what we mean by passive inhalation of marijuana smoke can leave sufficient levels of THC, again, the psychoactive ingredient in marijuana, the thing that gets you high. So can leave sufficient levels of THC metabolites to result in false positive indications of marijuana smoking. Although the density of the smoke that needs to be present for this to happen makes it unlikely that individuals be completely unaware that they are being exposed to marijuana. So what are they saying there in plain English? They're saying, that probably the smoke would have to be dense enough in that room that you would be aware that there's marijuana smoke all around. And it's so it wouldn't be, they're saying it'd be unlikely to be a case that you would breathe this stuff in and didn't even know that there was any marijuana smoke in the air. You would probably be aware of it. It would probably be pretty thick, dense smoke for this passive inhalation to be strong enough for a test to pick it up. A positive result in a drug test, however genuine it may be, indicates merely that the test has detected a minimal level of the drug at the time of testing. It's difficult to determine when drug taking occurred. See, so that's a limitation of these tests, is they may be able to detect a certain amount of the drug in your system, but much more difficult to be able to say, okay, this is when the drug was consumed, when it was taken, when it was started, how long the high went, and when the effects of the drug ended. It's hard to get the timing of all this from these tests. In the case of urinalysis testing, the time it takes for the body to get rid of the metabolites, of course through the urine, of a particular drug varies considerably from a few hours to even a few weeks. So again, there's a broad range here of how long it takes the body to get rid of these drug metabolites. In the case of oral fluid, the saliva drug testing, the window of detection may be different depending on the drug of interest. So again, we have these question marks about timing. Depends on the test that you're using. Opioids and cocaine are detected within 2 to 3 days of ingestion. So that's like 2 to 3 day window that you're going to pick those up. THC in marijuana is detected within a period ranging from 1 hour after ingestion, fancy word for using the drug, right? Taking the drug, to 14 hours later. Because THC metabolites are excreted into the urine over a period of several days, or in some cases even several weeks, oral fluid testing for marijuana is better suited for determining when marijuana has been used last, because of this long window, this long period of time that the metabolites might be going out through the urine. That you're going to have more accuracy when it comes to timing if you're using the saliva test. If the interval between use and testing has been longer than 14 hours or so, but shorter than a few days, urinalysis would pick up a positive result, but oral fluid testing would not. See, so again, whether you come back with a positive depends on the test you're using, right? So there's variables here, there's question marks. Owing to the expense of randomized drug testing programs in the workplace, not every organization can afford the costs. So this would be something that if you found drug testing in the workplace, it's likely to be in a larger organization that has the resources, the funds to be able to pay for this kind of testing. So your smaller organizations, your smaller businesses, would be less likely to do this kind of drug testing because the cost may be prohibitive. So large corporations may be able to budget for potentially thousands of tests for pre-employment screening purposes, but smaller businesses might not. So that's the same point that I'm getting at here. What they've added to what I was saying was that we're talking about screening that you're using at employment. So somebody comes in, applies for a job, they take a test. Well, that's more likely to to be happening in a large corporation. So if that's an issue, if drug use and abuse is an issue at your place of employment, that gives the large businesses an advantage because they can afford to do this kind of screening. A small business is going to have to roll the dice and hope that there's not drug issues with this employee because they may not have the money to be able to do this sort of pre-employment testing. Relatively few colleges and considerably few high schools are able to secure the level of funding needed to test their student populations. So certainly money is a factor here. Even though these tests are cheaper than they used to be, they still can be too expensive for various organizations. Let's take a break right here.